Hi, you're listening to She Shield, your one-stop pod for all topics personal safety. I'm your host, Sofia, and my goal is to help educate women and men on concealed carry, martial arts, and all topics self-defense. Before we get started in today's episode, please take this moment to rate the podcast. If this is your first episode, welcome. Otherwise, if you have a good idea of how you feel about She Shield, you can help us get our name out there by going to the top of wherever you are listening, top or bottom, and click on those stars and submit feedback. Like I said, it just helps us get out there. So if you've done that, thank you so much. This episode is sponsored by Big Tex Ordnance, your soon-to-be favorite retailer for all of your firearms needs. BTO believes in only selling high-quality gear for responsibly armed citizens, as well as providing pre- and post-sale support. BTO values firearms training and supports firearms instructors nationwide. They even pay for their own staff to train with high-level instructors so that when you reach out as the client, you are taken care of. Today, we have Jill Sharp on the podcast. Jill, thank you so much for taking time to come on today. I've heard so many incredible things about you from your lovely husband, Paul. He has come on the podcast already. So if you're listening and you want the best of both worlds, go and check out that episode, hear the praises of Jill, and then come here to listen to this episode to get this full picture that I'm so grateful to have. So Jill, I would love for you to introduce yourself to the listeners.
Thank you. Thank you for having me. I'm excited to be here.
Hey.
My name is Jill, and who am I? I'm a nurse. I'm a registered nurse. I work at the Boyce VA Medical Center. So I don't know why I identify myself first as a nurse, but I think I just kind of always have been one by nature. I'm a nurse at the Boyce VA Medical Center. I am a practitioner of Brazilian Jiu-Jitsu. I'm a purple belt and sort of squarely in that purple belt journey and really, really enjoying it. I'm passionate about self-protection and self-defense. I have been a volunteer instructor for women's self-defense seminars put on by our gym, the gym that I train at, SBG Idaho here in Boise. And I'm also a certified instructor for the VA for prevention and management of disruptive behavior. So I teach the federal VA curriculum for disruptive behavior, but also self-protection for healthcare workers. When I was in nursing school, I became very passionate about violence against healthcare workers and how healthcare workers could better protect themselves. And that actually led me to my husband, Paul Sharp, his expertise in, self-defense and self-protection. He became a mentor of mine, and ultimately we ended up getting married. So that's really exciting. So Paul and I now work together. We have Paul Sharp Coaching. So we do health coaching, fitness coaching, mindset coaching. We travel around and teach seminars. I'm his assistant, whether it's for combatives or we teach pistol classes here at Blacks Creek Range here in Boise, Idaho as well. So yeah, kind of travel around and do it all these days.
Absolutely. Do it all sounds like a perfect synopsis of all of that. Before the episode, we were chatting, and I feel silly. I did not know that you were not only an advocate, but a teacher for preventing disruptive behavior for medical staff. That is an incredible perspective that I would love to go into today if you're willing. I know there are some other super exciting things we're going to talk about today, like your journey in jiu-jitsu as a woman. That is always something that I love to get on the podcast, get other women listening to and comforted, through. And in addition to that, of course, the dynamic that you and Paul have and how you balance that relationship in light of also being training partners, work partners. That is such an incredibly I feel like underrepresented topic in this industry, and it applies to a lot of industries. So just from our small chat before the episode, I'm excited to hear what you have to say about all of that. So thank you, Jill. And it makes sense that nursing came first. That is such an accomplishment. And it sounds like it has been a driver for everything else you do. So that makes total sense. Did you say what department of nursing you work in?
So now I am in primary care. So
Primary
I'm in
care.
nurse care management. I manage a panel of patients on what they call a patient aligned care team. So I am on a team with a doctor, myself, I have a medical assistant and a clerk. So together we manage a panel of patients according to our roles. So I do a
Wonderful.
lot of care coordination, a lot of chronic disease management, and try my best to engage veterans in ways that they can modify their own lifestyle to improve their health. So that's where I'm really
Wonderful.
passionate about is people is first of all prioritizing their autonomy, their values, and their own personal health goals, and then seeing how I can influence them to modify their lifestyle and improve their health before they, get too sick or have to start taking a bunch of medications, things like that.
Absolutely. How lovely. I have such an appreciation for preventive health. In fact, when I was going through med school and that whole 5 years of my life I can never get back, I tried to implement as much preventive health as I could. And it's difficult in a society of Western medicine to do that. So I have a lot of respect for you for implementing that, because it sounds like you're in a great position to do that, an authority position, and you're able to influence your coworkers. That's just so awesome to hear. So yes, thank you for sharing that. And you know what? I'm just too excited to not start with this on the episode today. Could you tell us more about the training you've had for disruptive behavior, and at what point you decided it was time to become a badass purple belt, please? Of course,
Yes,
white belt
absolutely.
first, but
Yeah, so I think my journey into self-protection, self-defense, things like that happened first with jiu-jitsu. So when I was in college doing my prereqs for nursing school, and this was 8 years ago, I'm a late bloomer. I did not go to college officially until I was 40.
okay.
I did midwifery before that, but I did a direct entry route. And so it wasn't a standard Western model of nursing education and then master's in certified nurse midwifery or anything like that. It was direct entry licensure. So we can talk more about that later. That was actually a really exciting
Please.
time. But yeah, I'm a late bloomer. So when I was doing my prereqs, I had to go and do something I had never done before and write a journalist style essay about it. So a friend of mine had suggested that I do a free consultation at SBG Idaho for jiu-jitsu. And so I thought that was a good idea. Some of my peers were jumping out of planes and things like that, but I'm terrified of heights, so that was not for me. So I showed up at SBG Idaho for this free consultation for Brazilian Jiu-Jitsu, which in my head I had pictured karate, I think, which a lot of people do, right?
Totally
And
fair.
so I was kind
Yes.
of, yes, I was thinking I was going to be karate chopping people or kicking them. So I got dressed in the gi, and what the coach demonstrated to me was a cross collar choke inside the guard, which is, just kind of a crazy thing to show a new person, especially a woman. But I
Yes.
left that consultation thinking, wow, that was the most insane experience. I just got choked and then choked this guy. But for some reason, I feel like he's my new best friend. And then I started doing some research on jiu-jitsu and the story of jiu-jitsu and, the story of Helio Gracie and then the Gracies and, having it move from Japan to Brazil to America. And I just became fascinated with it. So I was getting ready to turn 40 and I bought myself a 6-month membership at the gym as a gift to myself for my 40th birthday. I showed up at the gym on my very first day, and it was 6:45 in the morning, and I was the only woman in an all male class with a male instructor.
Love
And
that.
the instructor did not even bother to greet me, which to this day I still can't even believe, um
It's
but
crazy.
just yes. And then when I got home, I I rode my bike home, and I had just done jiu-jitsu for an hour the first time in my life, and I was just like, what the hell just happened to me? I was like a deer in the headlights. I was like a deer in the headlights. Like,
So
I have
accurate.
no idea what just happened to me, but
Right.
I'm going back. So my first class was on a Thursday. I was 40 years old. I had never been an athlete in my entire life. I was just coming off of years of chronic illnesses. I
Mm.
had just been working on healing myself through lifestyle changes and, lost some weight and things like this. But I had forgotten every childhood movement I had ever learned. And so,
Mm.
I mean, it's just kind of crazy. My body literally just did not know how to move. And I was so sore all the way through the weekend. I was so glad that the next class wasn't until Tuesday. So
Right.
I started training. I bought that membership. I trained, twice a week. And then as soon as I could afford to buy more, I was training every single day, going to open mats and just trying to learn as much as I possibly could. And it just changed my life. It influenced every single aspect of my life. It changed my confidence. It changed how I viewed conflict. It changed how I, kind of saw the world as I walked around and engaged with people. So it was so beneficial for me. Well, as I moved through time and started going through nursing school, you have to do research and you spend time doing your clinicals and things like that. And I, you just start experiencing, I don't know, this spectrum of, um, I don't know, like violence isn't necessarily the right word, I guess, even though you're kind of you're talked to or touched or, kind of moved around in ways that you shouldn't be as a healthcare worker. It's just a crazy
Yeah.
place to be. If you've ever spent any time as a healthcare worker in the emergency department or the intensive care unit, it's just a crazy place to be. And then so I was sort of experiencing the vibe of the healthcare setting and being around either people who were violent or people who were just sick and out of their mind, acting out, and then doing research on rates of violence against healthcare workers, and that it was just getting worse. And one of the things that I learned was that despite the development of any number of programs teaching healthcare workers how to protect themselves, the rates of violence were not going down. And that was really intriguing to me. And then you start thinking philosophically, like, well, is the onus on me to protect myself? Why can't these people control themselves?
Right.
And then you remember you're in the healthcare setting, and so you're just dealing with sick people who are, you know, they just don't have any control, or family members who are so emotionally distraught, they're dealing with the worst day of their life and they're, angry and abusive. So that just really started me on a journey of researching violence against healthcare workers and disruptive behavior and de-escalation and, how I see myself in an exam room or at the bedside, where's my just all of those things that we talk about. Where's my stethoscope? What's my escape route? How do you do a handoff report so that you are sharing really vital information with the nurse who's coming on after you? Just this whole spectrum of things that we have to think about. And so over time, sort of what I discovered is, I think what I would like healthcare workers to learn and really identify with is that their personal safety is their responsibility, and that the facility can put a number of safeguards in place, and they can have, a number of black and white policies, and they can have a number of programs to educate and inform you. But at the end of the day, your personal safety is your responsibility. And that really hit home when I became a prevention management of disruptive behavior, when I became an instructor for that. I teach classes to employees at the VA, and they have to be taught in such a way that the employees are not engaging in hand-to-hand drills with each other, because we're more concerned about employees hurting themselves during training. And so you can kind of see the conflicts there, where if you've never had somebody grab you and drag you, you have no idea the amount of force that it takes to, or you never develop the timing for it. And so I was thinking, how well am I actually arming my peers at the VA? How well am I able to demonstrate, what being pushed or kicked or dragged or, shoved, if they can't actually put their hands on each other? And then that really made it clear to me how important combat sports are, how important it is to actually train in an environment every single day where, you're fighting for survival, and you understand what violence in a controlled setting actually feels like. So I don't know. It's difficult for me to be an instructor for that class. The techniques that we teach aren't necessarily the most efficient, but they are the techniques that the VA has decided will work, should work, and must work in any setting that we're in. So it's a really interesting space to have my personal knowledge and expertise kind of conflict with my professional knowledge and expertise, if you know what I mean.
Absolutely. I mean, I've never been in that exact situation, but yes, that makes total sense to me. Man, wow. First of all, I'm just blown away, and I feel so grateful that we have this perspective on the podcast now. I talked to you a little bit about how I was pre-med before. I was a medical assistant, and then I worked as a jail med passer. That was the wildest job I've ever taken. So, I mean, my job with live fire is pretty interesting, but this was crazy. I mean, death threats, people rushing at me, things like I had to verbally de-escalate all the time. I didn't even know how to properly do it at the time. It just came out of me out of necessity. Like, I just remember it like it was almost like my higher self coming through, because I was like, I'm either gonna verbally de-escalate or die. So, and this guard that just graduated high school isn't gonna protect me. So, I love that we're talking about this. I didn't even know that this was a practice among the VA. I mean, I used to volunteer at the VA as a pre-med, and I'd never heard of this. And I definitely had a few situations that were a bit uncomfortable and ultimately a great experience. But I'm just so grateful. Again, I know I'm rambling at this point, but so grateful that we have you here today to talk about that. And I'm definitely going to send this to all my friends from med school and be like, haha, like I did something that applies. So, so thank you for that. Have you ever asked to be involved with the decision-making process on which techniques are recommended, or is that not something they even offer?
It would be, that would happen on the national level, and it
Oh,
would be
wow. I see.
very challenging. So, and take years because, I'm in a bureaucratic monolith and change happens
Yeah.
very slow. I think
Yes.
where I prioritize, the learning that I prioritize is definitely on de-escalation and just awareness when things begin to change. It's one of the things also that I love about Paul's work, or our work, when we're talking about self-defense and self-protection, is you need to work on developing an awareness of how things are changing so that you can either create space or change the setting or begin to manage the energy of the situation and de-escalate sooner. So what I do feel is that oftentimes in the healthcare setting, these situations can be avoided completely if we have more practice in de-escalation. But some of it, if you aren't, working on boundary setting and personal space and listening more so that you can get a sense for these escalations, then you'll be late. And that's like white belt, blue belt stuff, right? When we're doing jiu-jitsu, it's all about timing, and you get timing with reps. You progress through jiu-jitsu by developing your timing to the point that you can kind of see the future. And so that's where I feel like the real solutions are when we're dealing with complex family situations or just angry. I mean, I work at the VA, and so these veterans are dealing with with this monolith, like I said. And, a lot of it's we have an archaic charting system, and they have to dial, 9 numbers in a phone tree before they get to talk to a live person. And then they have to leave a message. And, there's just all these little pain points for them along the way. And so, so anyway, with my training, I have just decided, as the role of the PMDB instructor, these techniques that I'm showing them are not going to stick. But if I can get them to really focus and hone in on the verbal exercises, the verbal jiu-jitsu, then that's where their safety will actually, that's how they will be able to stay safe. So I've had to make some adjustments. And then as I can, I'm like, come train with me at the gym.
It's definitely going to ask that. Yes.
I would love to do jiu-jitsu with you.
That is so lovely. And I'm sure they greatly appreciate that you're offering a resource, since you can't do it very much in person in those moments. I love that you invite them to the gym. When it comes to that awareness, because the way you made it sound, it's awareness so that if you need to de-escalate, you can start preparing for that, and then kind of moving on to creating space in a situation where you don't have to get into a physical encounter. Correct me if I'm wrong. It sounds like that's the breakdown. Would you be willing to go into what steps you teach? I'm sure it is such a dynamic and just long lesson, but would you be willing to share pieces of that today on the podcast?
Sure. A lot of it literally is high quality customer service. It is
Okay.
high quality customer service. So when we do role playing activities, somebody plays the role of the angry veteran. He's just spent 20 minutes trying to park and he's late for his appointment, and he's, loudly on his cell phone, stomping through the waiting area, complaining
So
to his
real.
wife, all of this stuff. And so honestly, in my situation, it comes down to high quality customer service and validating their experience. I mean, it is just, it means something when, somebody like me, they're just says, I understand that you're very frustrated right now. I'm here to help you. What can we do right now? And literally, I think, like, oh my gosh, so many situations can be brought down right there. So at the Boyce VA, we have a really nice culture, and if you see somebody who looks lost, you ask them if you can help them. And if they are truly lost, then you take the time to actually walk them to the place that they need to be. And it doesn't matter, if you're late coming from break, or it doesn't matter. The situation doesn't matter. The priority, no matter what, is that everybody is safe and that we are helping people move throughout the system. And I love that culture. Um, I love that part of the culture. But I think, yeah, it's just high quality customer service. And I use this now in sort of all of my personal relationships is, just high quality customer service and validating people's feelings and experience, and just what can we do right now to get
Yes.
you taken care of and to help you. But when I first moved from the inpatient setting to the primary care setting, I had this situation, um, you know, my first couple of weeks in the clinic, there was, just this outburst in the front, where the clerks work. And I had walked out there, thinking, what's going on out here? And there's this 6'4", 6'5", 250-pound man out there just yelling at everybody. There was a line of veterans behind him, and, 6 clerks and a nurse behind the clerking, not barricade, but the counter there. And he was just off the rails yelling, this happens every time. Nothing's ever
Oof.
right. I shouldn't
Mm.
have to do this, and on and on and on and on and on. And so I had witnessed this experience, and one of the male nurses got him calmed down and took care of him. Well, 30 days later, I get a message from one of the clerks saying, there's a veteran out front and he's really upset about a medication refill. And can you please come and help? And I opened the door and walked out, and it was that guy. And my heart just instantly started beating, and I was instantly just nervous,
Of
kind of
course.
scared, and oh my
Oh,
gosh,
yeah.
what's going to come next?
Yes.
And so I introduced myself and asked him how I could help him, and he flew off the handle immediately flew off the handle.
Jeez.
And then I responded by being like, hey, listen, it's not appropriate for you to be yelling at me, and I can't help you, and he's towering above me. And I was, I don't know, probably, 20 to 24. I was right in his personal space. And I wasn't doing anything to de-escalate the behavior. In fact, I was kind of feeding into it. And the clerks called the VA police. They pushed the panic button. And then pretty soon there's 6 cops, myself, him, my manager, a waiting room full of people. And it was just complete chaos. And when I reflected on that situation, I recognized all sorts of red flags for myself. I didn't
Yeah.
show up in, I allowed myself to get anxious right away. So I had no control over my emotions. I wasn't even breathing, I don't think. I just instantly was scared. I didn't manage my personal space at all. I was within, he could have grabbed me. He could have done any number of things. And it doesn't matter how much jujitsu I have. He's still towering above me. He's incredibly strong and he's a man. He's a big, strong man. And so I
Yes.
just did all of these things wrong. And so I made myself some promises. And at that moment, it's okay to take the time so that you can show up uh, in with the right attitude.
Mm.
And then you have to manage your space first, and then manage the energy. Have very clear boundaries, and give very clear, very simple instructions right from the beginning.
Mm.
My name is Jill. I'm a nurse here. I can help you. I'd like you to have a seat so we can talk. You know,
I love
and
that.
then so that sets a boundary. It gives them a very simple instruction to follow. When they follow it, then that's a signal to you that you can move forward. If
Mm-hmm.
they don't follow it, then it's them testing your boundary. And so, then you kind of you start recognizing which way you need to go, what path you need to go down. So yeah, it can be
Absolutely.
really, really exciting.
Yeah, I bet my husband is the audio engineer for this podcast, and I bet he's listening to this and he's thinking, I'm about to use this on Sophia because when I'm sometimes, I can be that 260-pound 6'5" dude, and my husband is so good at de-escalation. He's like, love, let's sit down. Let's maybe take a moment. And if I'm like, no, I want to stand, he's like, okay, well then let's definitely take a moment or something. I'm being dramatic, but this when you said you apply this to other relationships, that's so true, like the testing of boundaries and all of that. This is helpful for anyone listening. This isn't just for healthcare professionals. It sounds like, even though I love that we're gearing it towards that because, so many, I'm sure many listeners work in healthcare. So, yeah, I love that. So like regulation of emotions and then creating personal space and then giving clear instructions. Are those like the first few
Yes.
steps? Okay.
Very simple, very clear instructions.
I love
Yeah.
that. So when it comes to, say they push that boundary, what is the next series of steps, if you don't mind sharing?
Yeah. So if they're not respecting your boundaries, then it's creating more space and getting other help.
Hmm.
So, it could be asking the clerk to get the nurse manager, you know what I mean? Another authority
Mm-hmm.
figure out there.
Yes.
Or, sometimes you'd need a second. Sometimes it's helpful actually to get like one of the male nurses or one of the male LPNs or male clerks out there. But then, yeah, it's like, okay, create a little more distance and get another person to help or remove them from the space entirely. Let's go someplace where we can talk. That's not in, a private area where you're going to be alone with somebody. Although it may be, we're going to go back here and I'm going to put you in this room and I'm going to go get more help, so you just have to think about that.
Okay.
More boundaries, changing the space, bringing in additional help.
Absolutely.
Yeah. And then just very simple, very direct commands, even if it is, once you've lowered your voice, then we can continue the conversation. That works, or just like your husband used, we're going to give this a minute. Okay, I'm going to have you sit here. I'm going to give you a couple of minutes and I'm going to go get more information, sort of
Ooh, I like
whatever it
that.
takes.
Yeah.
So,
Not I'm going to go get Jerry, but I'm going to go get more information. I love that. Okay. Yeah.
I'm
And
going to get more information, or I'm going to see if there's somebody who is better able to help you, or
yes,
just whatever it is. Yeah.
I love
It's
that.
kind of interesting. Sometimes sometimes the
Oh
veterans
no.
um, they will check each other. And so we had a gentleman come over. I have so many funny stories,
Oh,
but we had a gentleman
please.
come over, kind of the same thing. He wheeled himself over in a wheelchair, and he was only in his underpants and a t-shirt, and and
Solid.
sort of making these unreasonable demands on the clerks. And one of the nurses had come out, and they were just like, listen, I just need a little bit of time, let me figure out what's going on here and I'll help you. Why don't you park yourself right over there and I'll be out in 5 minutes. But there was a veteran sitting in the waiting room, and he told him, he said, listen, these people don't have any control over that, and you're yelling at them and they have no control. You need to be more respectful when you come here. And he listened to him. So, that's a really interesting dynamic at the VA too, that I think is very unique to the VA, is you have veterans that are also trying to regulate each other. So it's a really interesting, it's a really cool place to work.
Oh, absolutely. It sounds like it. And I'm not trying to brag here, but I did get 200 volunteer hours. So I'm just kidding. I really did. But it really was. I miss being there. There was, for every one strange interaction, we'll call it strange, there were 50 great ones. And yes, those kiosks, if you're listening and you don't know about this is a problem. Like, I would be sitting behind a desk as a volunteer. Some days I wouldn't do anything but clean. I would just clean. I would go ask the nurses if they needed me to like take vitals so they can take a second to chart, whatever, or do all that. And I'd be sitting behind a desk, and it's almost like 1 in every 5 VA patient would walk up and ask what to do. And I'd point at the kiosk and they'd be like, what is this? And I'd be like, I got you. And I'd walk them through the kiosk. It was like, I always wondered why don't we have like a real why don't I just do this, right? I don't know if you know the answer to that, but it was definitely, it's almost like it primes them to be frustrated before they get to you. And I love the gentleman that would just joke around. They'd be like, well, I'm an old fart or something. And they'd be like, this is hard for me, or and they'd joke about it, it'd be fine. But I did witness a bit of that. So it's interesting to hear how you all navigate it.
I have great news.
Oh,
they got rid of the kiosks.
Oh my gosh. It has been like 3 years. So that is incredible.
I think it was just, just last year, literally probably 6 or 7 months ago, as part of their modernization. I believe the kiosks, they're gone in our facility. I believe that they are all the way gone. So
very nice.
We're making moves.
Yeah, for real. It's like, do you want to spend more money on police officers to handle the anger, or do you want to hire someone to work, a computer and people skills? I mean, yeah, I'm glad they listened to feedback. I'm sure that took forever, but I'm happy to hear that. That's awesome. Say that you had more influence over the program. You mentioned you would add in more awareness, de-escalation. Is there anything else that you would add in that you can think of?
What I would love to see is funding for training. You know what I mean? Just pay for people to have a membership at a jiu-jitsu gym, so that they, or any gym, but just, it seems like we spend a lot of money on, these whole health initiatives, and oh gosh, I don't know. Just there's this big push on preventing healthcare worker burnout, and, setting aside time during your workday to do these meditation exercises and this mindfulness, and while I think those things are valuable, and I love it, I really wish that there was more actual dollars for people to spend on training themselves, and that it was really pushed as part of the culture, that you need to be able to move, you need to be able to bend and crouch and lift and all of that. We work in a healthcare setting. We should be promoting health with employees and really incentivizing that. But put people in a situation where they can actually drill these things. I understand if we can't do it in the workplace because we can't cause workplace injuries, but I think we can put people in a gym or we can do programming outside of work and fund that outside of work, where we can actually see what it's like to get, like I said, pulled, pushed, dragged, all of that other stuff, and develop technique for coping with it under pressure. So if I could change anything, it would be that.
That's
I
so
would like
interesting.
to spend less time. I mean, I hate to say it, but I would like to spend less time with the mindful moments and more time with the physical moments. Does that make sense?
Yes, absolutely.
Yeah.
Yeah, it
I think
absolutely does.
for especially because I came into jiu-jitsu at 40 years old, squarely in adulthood. And, like I said, coming off of, a couple decades of chronic illness and health challenges,
Mm,
and really not even knowing how to move. You know what I mean? I mean,
yeah.
I remember as I started to develop, I remember sitting up in bed for this one morning in the middle of the night and thinking, oh my gosh, I just used my abs. And I hadn't used my abs in 20 years, since I had a baby. And that's crazy to think about. And so I often think that people feel like they have more physical ability and agility than they actually do. And until you're put in a situation where it's tested, you will not know that. So why not test it voluntarily every single day? Have fun, create this community of people, bond with all of these amazing people, and really make yourself um, a capable person,
Absolutely. Absolutely. Something that I remember I've just explained to so many people at this point about jujitsu. I try not to shove it down their throats if they ask, and it seems appropriate, of course. I tell them about how you don't realize that you actually, it's hard to control your body in a 3D space. Like, it's not something that we are designed to just have innately. We have to acquire it through training. And I relearn it all of the time whenever I take a break from jiu-jitsu for whatever, no surgery, traveling, whatever, and I come back. It's like I relearn it all the time. And I think of my friends and family who have never trained, and I consider, what would an interaction be like for them if there, were to be a physical interaction. It's scary to think about. So I love that you're introducing that concept and planting that seed so that, hopefully it can grow. And I love that you're bringing up this funding issue. I almost want to send this podcast episode to someone, like just send it to I need the emails to send it to, and I can be like, hey, listen up. So this is what you need to do for PMBD. So, no, I love that. And just the mind muscle connection, like bringing that up today. Absolutely love that. Is that something you cover with your staff as well? Like the preventive aspect and just getting healthy before maybe taking jiu-jitsu or with jiu-jitsu?
I I think people should start jiu-jitsu at any point they're considering it. I don't care if they're injured, fat, or out of shape, whatever. I don't care. Just start. And yes, I am never like, you should think about learning 30 pounds and you should be able to deadlift your body weight before you start
Right.
jujitsu. No way, man. Just get yourself to the gym. With my peers, I'm the same as you. I really, really try not to be like this missionary, I guess you could say, like
It's a
wandering
great
around the
word for it.
building, telling everybody. I mean, I want to be that
Right.
person.
Right. Come here, kind of thing.
Yeah. And
Yeah.
even with classes, maybe I will mention, because people will remark on, like, oh, it looks like you work out or you look like you're in shape. Yeah, I do jujitsu and I weightlift, run with my husband. I do all these things. And so I'll use that as opportunities. I think it's interesting because you probably get this a lot as well, where other women that are on your periphery are looking at you and saying, you're such a badass. I could never do that. Do you hear that?
All of the time. And it's not even to brag. It is just the I can never do that is always the like worst part to hear. Like you can tell me I look strong all day, but when I hear people say I couldn't do that, that's when I'm like, let's talk about that. Why do you feel that way?
Yes.
You
I
know?
totally agree. It stabs me in the heart because
Yeah.
I'm like, listen, I'm nothing special. The only thing that was different about me was that I did put myself in an uncomfortable situation. And when I could feel myself become interested in it, I said yes.
I love
And
that.
then when it became hard, I kept that promise to myself and I kept going. And so it's not like I'm a badass or that I'm special or different or anything like that. But the little differences were that I said yes. And that when it got hard and it got uncomfortable, I stayed with it. When I got frustrated, I stayed with it. And it's been so good for me. And I think it's been good for you too. And other women that we train with, that we work with, it changes us. And I wish that instead of, people on our periphery is interpreting that as, oh, well, I could never do that. I wish that they would
Mm-hmm.
be inspired with it and that it would reassure them to know that all they need to do is show up in whatever state they are in that moment and say yes. And then make a promise to yourself that you're going to keep going. And then you keep that promise.
I love that. And it's speaking to me too, as I sit here a week from my last jiu-jitsu class. Anyway, uh, no, but truly, I love that you said that. Oh man, I wish I'd said it earlier, but you were on such a great train of thought. I didn't want to interrupt. When you said there's nothing special about me, I was going to be like, I think Paul would disagree, but, just because of the way he talks about you, it's awesome. But anyway, so yes, I love that. I actually recently, like 2 days ago, got a DM and it was like, hey, where do I need to be at physically to start jiu-jitsu? And I was like, wherever you're at currently is where you need to be. Damn, does it whip you into shape? Like, I mean, you will sweating during sparring is like, it's different. It's a different kind of sweating.
Yes.
It's different. So yes.
A soaking wet gi or being able to wring out your rash guard.
Yes.
Trying to put your sweaty hair back up in a ponytail. I mean,
yes.
And being with somebody whose body is so slippery, it's just slipping out of your hands. I mean, the whole
yes.
thing it's crazy, but it feels so cool. It feels
Absolutely.
so cool.
It's a great way to put it. I actually saw a girl on a reel the other day put a swim cap on to protect her hair. Have you ever seen that?
No, but that's a great idea.
Oh my gosh, right? Like my hair's not super long right now, but part of the reason I cut it back in the day, I do this impulsive thing every 6 months where I like cut it to my chin. I've decided to wait until 2025 SHOT Show, so we'll see about that. But it's because of jiu-jitsu. It's like getting your hair like kneed during a match. It reminds me of that scene from Saw where he connects. Have you seen? Do you know what I'm talking about? Where he puts her ponytail into a machine and it pulls her scalp off. That's what it feels like. So the swim cap thing is genius. Anyway.
It is.
Right?
Yes, and I'm going to mention that actually to my female training partners. Yes. I love it.
It looked like it stayed on. She showed her roll and man, you know what? I'm going to go find it and send it to you because it's just too funny. And she's like, she's being like goofy and playful and fun, which is, how it should be. So it's so cool to see. Beyond jiu-jitsu. So I hate to even go here, but let's say that someone is wanting other resources or even training modalities. What would you recommend in addition to jiu-jitsu?
Weightlifting and running.
Okay.
Swimming. Yeah. Okay. Anything. Paul and I have do you mean training resources for conflict or do you mean just getting in shape and getting healthy?
Let's do both.
Okay. Well, training resources for conflict. I love Paul's curriculum, whether it's his combatives or just his managing unknown contacts. People who have taken ShivWorks curriculum will have done this work. the thing that I love about it is he does show technique, but he spends a lot of time talking about how to recognize if you have passed the victim selection process, right? So there are signals, if we're paying attention, there are signals that we should either, it's our intuition, the hair standing up on the back of our neck, letting us know we've been selected, or, specific movements. And I love his law enforcement perspective, his undercover work, just the thousands of people that he has taught, the thousands of women that he has taught self-protection and self-defense to. So I like that managing unknown context curriculum. So I think, there's lots of self-defense programs out there. I mean, there's a lot to choose from. And I think, I don't know. It's hard to talk about because you don't want to be like, but ours is the best, but my husband's is the best.
Right.
But
I
I
mean,
think
it's good that you feel that way, I think.
yeah, and the thing that I like about ShivWorks, about Paul, about SBG is that, this group of people have actually been pressure testing these things since the 90s, right? They are all experts and they've actually shown up in a training environment and they have pressure tested it to see if it actually works. And I feel like that's important. So I don't know if you know much about SBG, Matt Thornton, the president of that company, or Paul, or how these people even met.
I actually don't know the origin story. I only got to take a small workshop from Paul, unfortunately. So, as in, like, only got to take the small workshop, unfortunately, not from Paul, unfortunately. Sorry. Anyway, but please do tell.
Yeah, the origin story is really fascinating. I think it is. But, it started in the 90s in a chat room and they were all learning JKD. And so there was a lot of conversation, like, here's this martial art, but does it actually work when it's put to the test? And so, I mean, these people, they were from all over the country. They end up getting together in a room and they decide they're going to pressure test it, wearing football helmets and, they were stick fighting. They went through all of these different arts and put it to the test to see what actually works, and that's like wrestling works, boxing works, jiu-jitsu works, JKD. We can pick out a lot of flaws there, some of this other stuff. So their origin story is really cool and it would make for just a good show. But what I love about what Paul brings to the table, Craig, the ShivWorks curriculum, the stuff that SVG does is it utilizes people with just decades of experience. It's well researched, it's evidence-based, fact-based, and it's accessible. And that is really crucial. It needs to be simple enough, but no simpler. It doesn't need to be stupid. It just needs to be simple, but it can't be extravagant, multi-step, a ton of things that you have to try to think about or replicate. And that is the difference between instructors who have faced real violence and people who are designing curriculums who have faced real violence. So, and that's not to say that there aren't instructors who are, that can't replicate, teach curriculum and teach it incredibly well, but it needs to be a good curriculum. So I think some of the stuff gets really convoluted and really complicated, and you spend a lot of time trying to teach a bunch of techniques that people won't be able to replicate, when really what we need to be honing in on is people learning to develop and trust their intuition and recognize learn how to do boundary setting and recognize when people aren't respecting those boundaries so that they can get out of danger sooner. Does that make sense?
Absolutely. Like the difference between setting boundaries and reinforcing boundaries, kind of, is that?
Yeah. Yeah. Yeah.
Yeah.
Just like in that, that paradigm of one of the drills that we do is telling somebody to, stop right there. You can ask me your question from there. And they keep walking toward you. They didn't listen to you the first time. They didn't care that you said stop. So they're already they're testing that boundary line, and it's recognizing those signals sooner that will keep people safer rather than, missing all of these clues, one or two or three or four clues. And pretty soon somebody's right in front of you, taking you down, and you have no physicality, no technique to cope with that. And the 6-step system that you learn at the 2-hour self-defense test, or the 2-hour self-defense class that you took last year, it's not there.
Right. Yes. I love that you're illuminating how important it is to continue practicing de-escalation. Something I do with my sisters, I've mentioned this on a few episodes, following ECQC, is I explained the program to them. Of course, they know I'm not like certified under Craig. I'm not part of the collective or anything like that. I just have my little notes, and then I go through what Craig taught in our course, and then I yell at them, and I get loud, and I make them get loud back.
Yes.
Especially my middle sister. She's gotten tougher recently. I need to give her more credit. She's an opera. She's going into her PhD for opera, and she teaches middle schoolers. So since she started teaching kiddos, she's gotten louder, which is kind of scary for me, the little sister. But all that to say, I try to do some verbal practice with them, and they'll be like, Sophia, we've already done this. And I'm like, right. So now let's do it again. And that way it can kind of stick. Because even when I do it again, I seize up. Like, I even did like a little pepper spray workshop with Chuck Haggard at the Guardian conference, and I like had a hard time pepper spraying my partner, even though he was like, dude, just pepper spray me already. And I was like, I like panicked a little bit. I was like, I want to hurt you. Like I went through the whole thing again that I went through at ECQC. And anyway, I'm rambling at this point, but I love that you're bringing this to awareness and also pushing boundaries. I don't know if I just haven't been listening, but I've never had it articulated like that to me. And for some reason, that's like clicking for me a lot better than everybody else that's taught it. No offense to those listening that have, no offense, Craig,
No
but,
offense.
right. I really like the way you just explained that. That's very helpful.
Thanks. Thank you.
Yeah.
I think too, one of the things that Craig and Paul, one of the things that they stress is that you will become, you sort of, after you take the class and you learn managing unknown contacts, for instance, you sort of become that informal teacher, that informal leader. So it is your job to go back and take it to your people. If our purpose is to make people more capable and to empower them, then, we have to bring our knowledge to them. And so I think it's awesome that you took that back to your sisters. Also, when you're learning these skills, it's that approach of see one, do one, teach, or sorry, see one, do one, teach one, right? And so that reinforces that knowledge for yourself. So it's, you saw it demonstrated in class, you did it in class, and then you took it home to your sisters and you taught it, and that reinforced it in your mind. And so it's an important part of the learning process as well. So I think that's awesome that you brought it to them. Thank you.
Oh my gosh. Yes. Thank you. I remember feeling nervous. I love that you just touched on that, because I did feel nervous that I was speaking out of terms, and I never professed to be a ShivWorks Collective, instructor or anything I'm not. A friend recently said to me, just because you say a disclaimer doesn't mean you can spread false information. And so balancing that and like making sure the information is right. And then also balancing like, yes, it's okay for me to share this. I may have just learned it, but I've practiced it. I've taken notes. I'm not saying anything technically wrong. And I have good intentions. Like as when all those things are checked, there's no problem there. And it's taken me a while to learn that. It's like that balance between imposter syndrome and also getting out of my lane, like trying to like say what I feel like I can truly speak on, but also being careful so that I don't misinform and stuff like that. So thank you for empowering myself and listeners to be a leader, even if it's informal.
Absolutely.
I like the way you put that. I like wrote that down. Informal leader. Love it. Yeah, it's awesome. When it comes to your goals going forward, your personal goals, take a minute here and just talk about kind of you. What are you striving for in jiu-jitsu? What's the plan?
Man, my jiu-jitsu plan.
Right?
I actually, so yeah, okay. So
Okay.
it was when I first started, I wanted to, I wanted to try competing. Like I said before, I was never an athlete. So I forced myself to compete at white belt and
Oh,
compete
wow.
at blue belt.
Wonderful.
And then I got my purple belt and I have not competed at purple belt. And I don't know why I've got a lot of internal distress when it comes to thinking about competing at purple belt. Although I think
Mm,
it is important for me to do that. Really, where I've been training for 8 years. So I'm 48. I just had my birthday. So every age that I turn, that's always my jiu-jitsu anniversary. The
I love
big,
that.
the big shift in my training right now is to continue being a good training partner, but to prioritize my own training and my own path. So I am your quintessential maternal figure. I'm a gym mom. I want to be the best training partner and I want to make everybody's, I've basically spent the last 8 years making my training about the other person.
Mm,
Does that make
mm-hmm.
sense?
It does.
So just in the middle of a round, I'd be like, oh, well, I'm a little behind in this. So I'm just going to create an opportunity for them, whatever. So I'm done doing that. I have been very timid in my training. And part of that is just physically. So on my left foot, my big toe, I had hallux rigidus. So I hadn't been able to bend my left toe in about
Ooh.
13 years. It
Wow.
was, yes, yes.
Wow.
And
Okay.
so if you think about how, like being in an athletic stance or doing any type of wrestling or judo or starting from standing, if you can't bend your toe, then
Yes.
yeah, it's incredibly difficult. And so,
Oh my
and
goodness.
it's painful. That joint was destroyed by osteoarthritis and it was incredibly painful. So I had
So
joint
sorry to hear that.
replacement surgery 2 years ago. I just had my 2-year anniversary. So I have a brand new joint.
Okay.
And so anyhow, as I recovered from that surgery and, I'm going to this competition team practice every morning at 6 a.m. I've been really forcing myself to be very assertive, very aggressive, just very much developing an offensive game and hunting for submissions and worrying less about am I the biggest girl there? Am I putting too much weight, too much pressure? Am I, do you know what I mean? Just all of these
Yes.
things, I think as women, like we don't want to be heavy. We don't, someone's just like, oh my
Take up
gosh, you're
space.
so heavy. Yeah. Then
Yes.
that's a big negative. And so I've just, you know, um, really noticed a shift once I decided I was going to leave everything behind. I wasn't going to be afraid of making the wrong move. Um, And I was just going to plow ahead and be as heavy and assertive and aggressive as I possibly could.
Love it.
Then yeah, it's been huge personal growth for me. So I'm feeling like squarely like a purple belt right now.
Ooh, yay. Okay.
Feeling really comfortable with my body and how it's moving, and with my connection and my pressure and how I'm transitioning. Paul's my coach, and that is just so insanely cool and beautiful. I'm just during around letting him coach me, refine my skills. And then afterwards, he's going through everything. This is what you need to do next time. And I'm accepting all of the feedback in just a really extreme way. And it is awesome. So
I love that.
yeah,
That is,
I'm not in this race for brown belt or black belt. I think,
I love that.
the purple belt is the perfect place to be. It's depending on what school you're at. It usually, with SBG, it will probably take you 5 or 6 years to move through the spectrum of purple belt. Because you should really be kind of developing your style, developing your art. This is where the art in jiu-jitsu comes from, is this time. And so what positions feel good, and how can I funnel people from any position into my game? And so I think purple belt is super cool, and I'm really looking forward to just developing my style, developing my game, learning how to create these funnels to drag people into my game no matter where we're at. And then, the other stuff just comes, but I'm in no hurry, because once you get your brown belt or your black belt, people just want to murder you all the time. And I don't really want to
I've
get
heard
murdered all
about
the
that.
time.
Totally fair.
Purple belt's really fun.
Even the shift from white to blue, it was like all bets were off. I really thought I was good until I retired my white belt, and it's like everyone was smiling at me in a weird way, and I was like, what's happening? And I was rudely awakened into blue belt culture. So I can't imagine that purple and then on would be even more
Yeah.
challenging.
Yeah.
Absolutely.
It's really fun that the training hour that I have in the morning, it's a competition team setting. So it's a
Okay.
very, very fast paced, very micro fights, so you've got 30 seconds to work or 1 minute to work. And it is just like, I've never worked harder in my entire life. I've never sweated more. But I've got this great group of women and the men too in the room.
Lovely.
We will do some co-ed training, but Paul will also keep a female line, which is helpful, because then we're dealing, female strength, speed, agility. So
Right.
I love that. But man, it is just a murder session. It is just an hour
Awesome.
of, this pile of girls just trying to murder each other. And then
I
at
love
the
it.
end of the hour, just, talking about it, do a little after action review, talking about our work and
Yeah.
what went well and what we want to do, and teaching each other what you do here, what you do there. It's so cool. It's so
I want to
cool.
move there
So
now.
it's
I want
very
to be
cool.
there. Yes, I
You're wearing a
love that.
helmet while you train right now, right?
Yes. Yes.
So yeah, bring your second helmet and we'll all take
Oh,
turns.
absolutely. So I've learned you can't really you can't ask your partner really to roll without one, because mine is from Ben Aubin's Redbeard Combative store, and it has metal in it. So if I were to hit someone with that, it would be so hurtful on their part. So I always provide a helmet. In fact, you just reminded me, my very consistent rolling partner, Arlena, she's definitely the woman that has inspired me to roll again. She wears her so much that like I'm getting her own. I asked her, I was like, hey, what color do you want? She's like, I want pink. And I was like, right on. So I'm getting her a pink one because the black one that I have for my rolling partners, more and more people have been coming up and asking to roll with me with them because we do some striking as well. And so I'm having to like wipe it down in between rolls and then like dry it off really quick and then hand it to the next person. So I was like, this isn't fair to you, Arlene. I'm going to get you your own. So I will absolutely bring an additional helmet. I would love that. And honestly, after I saw the swim cap video, I was like, okay, I'm not the only one who has like their thing. You know what I mean?
Right.
So, right. It works out. So listeners, we are actually going to end this episode as the part 1 of a 2-part series with Jill. Since she is so multifaceted, in part 2, we are going to focus a little bit more into her journey in Jiu-Jitsu, as you've heard on this episode, as well as the dynamic between her and Paul and how they kind of navigate training together as a couple in Jiu-Jitsu, the power couple they are. She's gracious enough to share that today. So we're going to break this up for you. So if you're interested in hearing part 2, I highly recommend it. Head over to part 2 and we will see you there. For exclusive content, you can join the Patreon. To see highlights of this episode with the beautiful Jill, you can go to our Instagram or TikTok at SheShieldPod. All resources mentioned, including where to find Jill and all of the gyms she mentioned today, as well as Paul, will be in the show notes, which are the notes below the pod, or the notes below the title. Like I said, please leave a review today. And if you or anyone you know is a firearms owner experiencing a crisis, look into Hold My Guns. They are an organization that will connect you with the local gun shop or FFL to store your firearm for you in that time of need until you are ready to take it back. Their information will also be in the show notes. In the meantime, stay safe, stay vigilant, and see you in part 2.